So hi everyone, welcome to you all in my another video. And today's video is very important for you if you are a medical doctor and you are planning to move to US or either the Australia. So my name is Dr. Akram Ahmed and I always make videos for you, especially if you are planning to move to abroad, especially in Australia. You know, if you are a healthcare professional. And so A to Z information I always give in my videos. But today we have very special guest, Dr. Apuva, and he just completed his examination and he's moving to US for his residency. So we will know about the US and what the process in US. And I will also little bit compare at the end of this video, so you can have like a better understanding that which a country is better for you, whether the Australia or the US, as compared to the examination or the money you are spending and how much time you are spending, and you are getting the visa easily here and there. A lot of I mean the salaries and about the like savings. So a lot of things we'll discuss about here. So I'll just Apuva, hi, welcome to you in my channel. Apuva basically have a YouTube channel. You have, if you are planning to go US, so you must go in his channel, and a lot of videos he already upload. He itself is complete this exam, so he can give you the insight and a lot of tips from him I will get. So can you please introduce yourself?
Thank you so much, Dr. Akram, for this. I'm very happy to be here, and thanks for the great information. So basically, if I tell my introduction, I'm Dr. Apurva, but I have completed my all USMLE exams, step 1, 2, and 3, and I'm awaiting for my match results, and after that, I'm planning to do my residency in United States. So basically, I did my medical school here in India. That GMRS Medical College in Gujarat, and then afterwards I plan to pursue USMLE pathway, and so that's about me.
Oh, okay. Thank you so much. This is, he's trying, and he basically almost he achieved. He's just waiting for his, it might be like 1 or 2 months. He's moving to
Yeah.
US. So, can you please tell me more about this USMLE? How many exams and what is the eligibility for this exam?
Sure. So United States medical licensing exam, so that's USMLE exam. It's basically divided into three parts. That's step 1, which is basic science, step 2, which is clinical science, and step 3 is advanced clinical medicine. So in order to
can you please before that, is there any step that the degree they have to be assessment or something like? I mean,
Oh, sure. So like if you want to be eligible to give USMLE examinations,
yeah.
I think so. If you are in any medical school, your school just needs an accreditation that you can give your USMLE examination. But for if you just want to give your step 1 examination, you just need to pass your second year of medical school.
Oh.
So after you have passed so that's the baseline eligibility. So you can only give your step 1 examination after you have passed your second year of medical school. So that's the base first line requirement. And then if your school is accredited, that if your school is registered in that world like medical school directly, then you are eligible to give USMLE step 1 examinations.
Okay, then what about the step 2 and 3?
So so it's not like that. Okay, you have to give step 1 examination before giving step 2 examination. You can give step 1 or 2 in any order, but it's always advisable to give step 1 examination before, because it's a basic science examination. And there's a latest thing going on about step 1 examination, that now it has no more scores in it. So it's just pass and fail. So if you just cross the threshold of 196 scores, it will just be written pass. You won't be given any scores about your step 1 examination. So that's about step 1 and step 2 examination, like very basic.
And what about the step 3?
And you are only eligible for step 3 examination after you have passed step 1 and 2. So that's the basic criteria for step 3 examination. And usually students take step 3 examination in order to get specific visas. We'll talk more about visas, that if you give your step 3 examinations, you are eligible for H1B visas. And if you do not give a step 3 examination, then you might get J1 visas. So that's about step 3.
So basically, if I little bit compare from Australia, so in Australia, there is eligibility that you must complete your medical school, for example, MBBS in India, and you must be a registered medical practitioner in India. then you are eligible to go for first step, that is, this is called skill
Right.
assessment. Means they will see that
Uh-huh.
your qualification is equivalent to Australian qualification. Then you have to give AMC burn. Then you have to go for visa. So we will discuss in tomorrow another video about AMC. So this is little bit different from the US. So can you
Mhm.
please give us after this complete this exam one or two, then which kind of visa they can apply?
So yeah, that's a great question, actually, Dr. Akram. So basically, everybody wants to get a specific type of visa if they are planning to go to United States. So this thing only applies if you are not a green card holder or if you are not a citizen of United States. If you are green card holder or citizen, you can directly go there without worrying about any visa procedures.
Yeah.
And now there are basically two kinds of visa which United States gives for residency. One is J1 visa, and the second one is H1B visa. J1 visa, you'll be given J1 visa if you do not appear for step 3 examination, and there are different colleges, like only some universities or some colleges offers H1 and other colleges like offer J1 visa.
So
So basically,
how many years for this J1 visa? Like 1 year,
for
2 year?
you can stay in United States for a span of 6 years if you are on J1 visas.
Oh, okay.
So that's a threshold. So you need to finish off everything by 6 years, and that's a waiver visa actually. So waiver in the sense, actually J1 visa is like, you can correlate J1 visa is like, suppose if somebody is going from India to United States, that means your India is sponsoring you to get better healthcare in United States so that you can come back and serve your home country.
Oh,
So if you are on J1 visa, you have to come back to India to serve 2 years in India. And if you do not do that, you have to do a waiver job in United States at some of the remote location for at least 3 years. So that's about J1 visa. So if you get J1 visa, either you have to come back to your home country for 2 years, or you have to do a waiver job at very remote location in United States.
तो
Um,
इन वेरी सिंपल वर्ड्स इन्होंने कहा कि जो है आपको एग्जाम 1 और 2 देने के बाद आप J1 वीजा अप्लाई कर सकते हैं, जो आपको अप टू 6 साल तक मिलेगा। तो उसका कंडीशन ये है कि आपको अपनी कंट्री वापस आना है इंडिया, और इंडिया में आपको 2 साल जो है सर्व करना है, या उसका अल्टरनेटिव ये है कि आपको 3 साल जो है जो रिमोट एरिया है यूएस के वहां पे जॉब करनी पड़ेगी। व्हाट अबाउट दिस अनदर वीजा दैट H1 वीजा?
Right. So that was a great explanation, Dr. Akram. And actually, J1 visa is sponsored by ECFMG. So that's Educational Commission of Foreign Medical Graduates. So the sponsor of J1 visa is actually ECFMG. And the sponsor of H1B visa, that's the another kind of visa, is the institute itself. So every year your institute has to pay a specific fee to renew your H1 visa. So that's yearly process. And there is no waiver kind of thing in H1B visa. You don't have to come back to your home country, or you do not have to like serve in the remote locations. So that's about H1 visa. But the drawback of H1 visa is, after you complete your residency for 3 years, then there are very limited colleges which sponsors H1B visa for fellowships. So, and that's very easy if you are on J1 visa. Let's say you completed 3 years of training and now you want to do your fellowship. That's kind of easy in J1 visa, but it's kind of more trickier if you get H1 visa and if you also want to do your fellowships.
तो ये तो बहुत ही कॉम्प्लिकेटेड लग रहा है मेरे को, तो एज कम्पेयर टू ऑस्ट्रेलिया। ऑस्ट्रेलिया में तो बहुत ही स्ट्रेट अवे है, एग्जाम पास करो, डायरेक्ट पीआर को अप्लाई करो और आप यहाँ आ जाओ। तो वो हम लोग थोड़ा आगे कल बात करेंगे पूरे उसके पर। तो ये जो एग्जाम 1 और 2 का ये फीस कितना होता है? आई मीन इफ इंडियन स्टूडेंट, हाउ मच मनी दे हैव टू स्पेंड ऑन दिस एग्जाम?
Yeah, I just wanted to tell about PR as well. There's also one little shortcut way if you want to get green card for United States. So if you have a planning that, okay, you want to get settled in United States and get green card, so your first priority should be like, you should get H1B visa, because that will eliminate that you don't have to come back to home country or do not have to do waiver job. So if you get H1B visa and you are a scholar, research scholar, there are like 7 criterias for EB1 category. That's called EB1 category. That's just like premium visa, which you get.
Alien extraordinary visa.
Yes, that's
actually,
like perfectly.
ये दोस्तों दिस वीजा जो है ना, मेरा जो ड्रीम था बेसिकली, मैं ऑस्ट्रेलिया जरूर यहाँ पीएचडी करना आया, पर मेरा ये था कि मैं पीएचडी करने के बाद यूएस चला जाऊँ, क्योंकि मेरे बहुत सारे प्रोफेसर यूएस में हैं। तो ये वीजा को ही मेरे माइंड में था, मैं अप्लाई करूंगा, पर ऑस्ट्रेलिया में ये वीजा नहीं था। तो ऑस्ट्रेलिया में इन 2020 रिसेंटली दे इंट्रोड्यूस दिस वीजा, and I applied this visa called Distinguished Global Talent Visa in Australia. So I got, and was the first Indian to got this visa basically. So,
Wow.
so this is like a similar visa
Congratulations.
in US. Yeah, thank you. So this is same visa also in US also, but in US I can say I know many people in US. They are masters and PhD. Even they are still struggling. So it's not that much easy to got this way because a lot of recommendations you need. A lot of evidence you show.
Right,
A lot of research basically. So myself
right,
basically a public health and epidemiology. I can say the scientist. So my
yeah,
profile is like a top 5% in the world. So if I apply in
wow.
US, so I believe they will give me as well.
Definitely. So yeah, that's the similar kind of thing. For like, there are 7 criterias. Either you have like 100 citations, like in research, or maybe let's say you got like some Padma Bhushan or that kind of award in India, and like you are an international teacher and scholar. So that's how you get eligible for EB1, and you get
Yeah.
your green card in just 1 year if your lawyer
Yes.
files for that.
Yes. Yes. Yes.
And there's EB2 category as well. EB2 is like something your like hospital files for you, but that's again a long process.
Yeah.
Then if you have like enough of money, then you can file for EB5. Like let's say you have like a $1.5 million investment in United States, and then you get EB5. So there are certainly ways around if you are rich.
Yeah, that's not the case for everyone. Yeah. So can you please tell us the what is the cost involved in this exam, part one and part two?
Sure. So if you just talk about the examination, there are some registration fees as well. So I would say, okay, you can reserve like 200, 300 United States dollars for registrations and all those things. Um, then for step one examination, it's around 900 to 1,000. So let's take $1,000 for step one examination,
Yeah.
$1,000 for step two examinations. So that's the examination fee for step one and step two.
And then visa we have to be separately.
Yeah, and if you get H1B visa, then it's around like $5,000, but 2,500 is paid by the institution. You have to pay 2,500 for premium processing. But in a nutshell, if you just want to go to United States for like after like this USMLE, I would say in India it would be around 15 to 20 lakhs INR. If you say about United States, it would be around 20,000 to 25,000 United States dollar USD. That's the total expense, like including everything.
और एवरीथिंग सो वी कैन से लाइक 20 लाख का इन्वेस्टमेंट है अगर आपको यूएस जाना है, पर अगर आपको ऑस्ट्रेलिया आना है तो आपका इन्वेस्टमेंट है जस्ट 3 से 5 लाख का. तो
Yes.
ये डिफरेंस है. और ऑस्ट्रेलिया में आपको डायरेक्ट पीआर मिल सकती है, और यूएस में जो है ये 3 रूट के थ्रू, और ये रूट इतना इजी नहीं है ईबी1 वाला. तो
True.
या so yeah, can you please give us about the how to prepare for this exam?
Sure. That's a sizzling question these days, that how to prepare for USMLE. So if you are in a medical school, I would say start mastering your basic sciences, because it's the basic science. If you have a strong foundation, you can build up a concrete buildings. So that's what I mentor students. I have like my own coaching institute, but that's what I even say, that if you have a strong basics, because like atherosclerosis is going to be same in step 1, 2, 3, or just NEET or AMC, anywhere. Okay. So if you have a strong basics, you can build up a great heights. So if you are in medical school, like start as early as possible and master basic clinical science, and after that you master the advanced clinical science, and like practice questions and read textbooks. That's the way to go about that.
Is there any subject, like mostly they ask more questions from, for example, microbiology or physiology or pharmacology or something?
So I think for step one, it's like 3 P's which are major. That's patho, physio, and pharma. Patho, physio, and pharma like are the major chunk of, I would say, step one examination. And same thing is applied and clinical context in step two examination.
Okay. So, so and then this is, someone is planning to, for example, someone is want to give in year 3 or year 2 in India, and
Right.
then part 1, part 2, and visa and all this. So how much time is required? It will take.
So that's a great question, actually, because it requires a good amount of time to invest. But if you start early, let's say you give your first excuse me. So if you give your step one examination in third year, and you give your step two examination after your final year, then by the time you complete your internship, you are ready to apply for the match.
Okay.
But like if you are somebody like me, oh, now you want to go to United States after doing your internship in India, like MBBS, then you might have to invest on sit and study biochemistry again, like for like some time, and then you give your step one, then step two, then you apply. So it like earlier you start, earlier you can finish. So by the
Yeah.
time you complete your med school, you can be ready to apply. So it's good to have determination of country of where you want to go, like at like very early stage.
तो आई कैन से इन द कि आपको पहले से ही मालूम होना चाहिए कि आपका एम क्या है। अगर आपका यूएस का एम है
Right.
तो ईयर 2 में नहीं, मैं कहूंगा कि ईयर 1 के एंड से ही, क्योंकि पैथोफिजियोलॉजी आपको ईयर 1 में ही पढ़नी पड़ती है, तो तब से ही आप
Yeah.
अपनी जो है प्रिपरेशन रखें कि भाई मुझे यूएस को टारगेट करना है। तो जब आप सीआरआई के जो आप जब पोस्टिंग कर रहे होंगे जो है ना हॉस्पिटल के अंदर, तो उस टाइम तक सारा जो है 1 और 2 आप कंप्लीट कर चुके होंगे और फिर आप जो है मैचिंग के लिए जो है अप्लाई कर सकते हैं वीजा के लिए, ना। तो ये आपके लिए बेस्ट है। पर आप अगर सोचते हैं कि आपने पूरा एमबीबीएस कर लिया, इंटर्नशिप कर ली, अब आपको सोचना है कि अब मैं यूएस जाऊं, तो लॉन्ग प्रोसेस है, तो फिर आपके लिए शायद जो है ऑस्ट्रेलिया जो है बेस्ट हो सकता है, क्योंकि ऑस्ट्रेलिया का वही प्रोसेस है कि आप रजिस्टर करें अपनी कंट्री में और उसके बाद फिर जो है आप जो है यहाँ के लिए अप्लाई कर सकते हैं, ना। तो ये एक मेन प्रोसेस है। तो एक बहुत सारे जो स्टूडेंट एक क्वेश्चन किया करते हैं, सर कि व्हाट इज द सैलरी इन यूएस एज ए मेडिकल डॉक्टर?
Right, of course, like it does matter because you are investing this much of money, then you would be interested about like what's the stipend. So
Yeah.
if you are if you are a resident, you would be paid around $50,000 per year. So it's around like 4,000 per month. So if you just correlate that to India, it would be around 3.5 lakhs per month salary if you are a resident. So I would say if you are a resident, it's $50,000 per year.
Uh,
And once you are like after residency, if you start a job, it's around I would say if you are a good like at a good place, I would say around 2.5 to 3 lakhs per dollars per annum. So so
so
that's about
So basically,
salary.
when you are going to for residency, it's like कि आप स्टडी कर रहे हो, अब स्टाइपेंड गवर्नमेंट दे रही है 50,000, तो वो सैलरी नहीं है बेसिकली। आपकी सैलरी तभी है कि आपने जब वहां पर रजिस्टर कर जाएंगे एज डॉक्टर, फिर आपको जो जॉब लगेगा होता है कि 2.5 लाख से लेकर 3 लाख डॉलर, बेसिकली वो एक आपकी सैलरी है ऑन एन एवरेज। तो ऑस्ट्रेलिया के
Yes,
अंदर
yes.
भी जो है, अगर मैं कहूँ कि ऑन एन एवरेज सैलरी यहाँ पर भी जो है 2 लाख के आसपास है एक जनरल डॉक्टर की। मगर यहाँ बहुत सारे डॉक्टर बहुत ज्यादा अर्निंग करते हैं। यहाँ पर जितने भी जो टॉप 5 प्रोफेशन हैं, टॉप 10, तो उन टॉप 10 में जो है टॉप 5 जो अर्निंग्स हैं वो डॉक्टर्स की ही हैं। जो सर्जन वगैरह, जो ऑन्कोलॉजिस्ट जो है उनकी बहुत ज्यादा, और न्यूरोलॉजिस्ट, उन सब की जो है बहुत ज्यादा सैलरीज यहाँ पे होती है ऑस्ट्रेलिया
Yeah.
के अंदर।
And I think GI fellowship, if you become GI, like your salary, it's like it starts like from $500,000 per year.
यस यस, बट दिस इज नॉट इन इंडिया वेरी सिंपल। एमबीबीएस कर लो, एमडी कर लो, फिर आप जो है कंसल्टेंट बन जाओगे, प्रोफेसर बन जाओगे, सब कुछ
Oh,
बन
it's
जाओगे।
becoming very difficult, Dr. Akram, like because of like all the reservations here, like you get like competitive medical school, then fellows, what do you call residencies?
Actually,
It's big.
actually, I am working as a medical scientist, one of the hospital. So yesterday, I'm basically government medical scientist in Australia right now. So yesterday, I met one guy. He completed medical school in Canada. When he moved to Australia, he just going to be 5 year resident. In the burn and the plastic surgery. So he was, he's saying this is very good as compared to Canada. Canadian guys coming here, and I was thinking that a lot of Indians going for Canada, US, in Australia,
Yeah.
and basically in Australia, most of the times you want to be a consultant or you want to be a professor, you must have PhD. Even you
Oh,
have clinical experience, you have 20-year experience, 10-year, but in India mostly they focus on not going for the research side. They are not going. And even I didn't see many they are going for PhD. They just MD or MS, and they are just start assistant professor,
right.
then associate professor, then professor, HOD, dean,
Uh-huh.
all those things. But in Australia, you must go for PhD. Even you are in clinical doctor.
Right, right, right.
So at the end, can you give us some your idea? I mean, your recommendation. Those are looking to for this USMLE exam. They want to go to US.
Uh, so, Dr. Akram, I would say if you are really determined to go for United States, first thing is like you start early. The earlier you start, you can finish off earlier. Um, learn from a good source. So because like basic science is not something which you like can learn from just like standard textbooks. So learn from a good source, like spend like some money on good coaching institutes. And the third one is you have to be stay motivated, because it's a long journey. You might lose motivation in between, and you
Yes.
might say, oh my god, like what am I doing? But so you have to stay tight if you just want to reach there.
So this is the end of this video. So if you are comparing with the Australia, yeah, I'm in Australia, so I always compare if we are comparing with any other country. So I can say that Australia is very easy to compare to US. So if you are if you are in medical school, you are in second year, third year, you can plan for US. But if you are like already you are did your MBBS completed, you are MD or something, you are MS, and you are looking which country is best. So I can say Australia, one of the best country for you. It's not just the money, the we are, the people mostly they ask then, how much money I can make in Australia, how much money I can make in US. So basically as a doctor or as a scientist or as a you are not just moving for the money, the quality of life, a lot of the factors, other factors are impact for that, so this is how we will tomorrow we'll discuss about in another video about the Australia. And if you have any comment, if you have any questions, please leave a comment. So and Dr. Apuva will also give the answers. And please go to his channel so you can find a lot of the videos related to this. And thank you for watching this video.